Let's make the first step in fixing your low back pain. Welcome back. If you're someone who's been dealing with chronic low back pain and don't know what's causing it or where to begin, then this is the video for you. Now, although I can't diagnose you through this video, I can help you take the first step in curing your low back pain, which is understanding your pain. It's important to know that there are different types of pain and not all pain is bad. Your pain is a sign or a signal from your body to your brain that something is going on. It'd be like if you walk into the kitchen and you see water under the sink. Now that's a sign that there may be a leak going on above in the sink. If you ignore this sign, it could cause bigger problems down the road for you. So it's important when you have pain to quickly address the pain. Don't just ignore it and push it off to the side. Now, just like you would with your sink, call an expert to come and identify the leak and then fix the leak. It's important to talk to an expert or a healthcare professional about your symptoms. So the first thing I want you to start thinking about is, where is your pain? A lot of times when patients come in to see me, they haven't really thought about where their pain is. They just say, oh, my knee hurts or my back hurts. So for the low back, is your pain to the right of the spine, to the left of the spine, centered on the spine? Is it closer down towards the buttocks area or higher up towards the top of the lumbar spine? When thinking about where your pain is, it's also important to think, does the pain move? Does it always stay in the right side of the low back or does it travel across to the left? Does the pain radiate down into the buttocks or into the leg at all? It's important to remember that just because the pain is in a certain location doesn't always mean that that's where the problem is occurring. One example is with a patient of mine who came in for left-sided low back pain. They got imaging for her back and couldn't find anything wrong, but when I did my physical assessment, I realized that her hip lacked mobility and strength, which was putting stress on those muscles in the left side of the low back. After improving her hip mobility and working on her strength, her back pain went away. So the pain was in her low back, but the actual problem was lower in her hip. The location of your pain is very important and will help us to correctly diagnose your condition. The next factor I want you to think about is what kind of pain you're experiencing. As we stated earlier, not all pains are the same. Nerve pain will present in a different way compared to muscle pain or joint pain. So it's important to think about and reflect on what kind of pain you're experiencing. Some examples would be sharp pain, shooting pain, aching pain, throbbing pain, numbness, tingling. These are all different types of pain and each one can correlate to a different cause. So the way I describe sharp pain, obviously very strong, sharp, but precise. Usually patients with sharp pain are able to tell me, I feel it right here, and they can point to an exact spot. If a patient is dealing with shooting pain, that pain is usually traveling or moving. So it starts maybe in the shoulder and shoots down the arm. Or it starts in the right side of the low back and shoots down the leg. Dull, nagging pain is usually a broader area. Patients say, oh, the whole backside kind of just aches and nags. Or my upper trap neck area is just kind of a nagging pain. Not very severe, but usually pretty constant, doesn't seem to go away, and it's always just there. Throbbing pain. Now this pain has almost like a pulse to it, or it kind of comes in waves. It can be constant or intermittent, but when they're experiencing it, they feel that it has almost like a rhythm to the pain. Numbness and tingling. Some people describe tingling almost like pins and needles, like when your foot falls asleep. So as you reflect on where your pain is, start to also think, what type of pain am I experiencing? The next factor is, when do you experience pain? Is my pain worse in the morning and gets better throughout the day? Or do you feel good in the morning, but the pain slowly creeps in as the day gets longer? Does the pain come on when you sit or when you stand? Maybe it happens when you're walking, uphill, downhill, upstairs, downstairs. For example, arthritic pain is usually worse in the morning, but as you get the joints and the muscles warmed up, that pain slowly starts to decrease. For some of my more active patients, they don't feel any pain while they're maybe jogging or playing pickleball, but then after when they get home and they've been sitting for a few hours, then they start to notice some dull aching pain. When trying to identify when your pain is, also think, is it constant or intermittent? Constant means the pain never goes away. It might be severe, it might be mild, but the pain is always there. Whether you lie down, sit, stand, you can't ever seem to find a position or a movement that gets rid of the pain. Versus intermittent pain means that the pain comes and goes, right? So maybe it only comes on if I sit for too long or if I stand for too long. That would be intermittent pain. Lastly, I want you to think of aggravating or alleviating factors. Aggravating factors is anything that can recreate the pain or make the pain worse. And alleviating factors are things that can eliminate the pain or make the pain better. As your physical therapist, if you're able to provide me with this type of information, I can think about what are you doing during these aggravating factors and break down the specific movements or causes that's making the pain worse and help you to, one, avoid those types of positions or movements. Two, I can use that information to give you exercises that move you in the opposite way, which should help alleviate the pain. And of course, if you know alleviating factors, things that make your pain better, then we can design you an exercise program based around those types of movements, since we already know that your body likes to move that way. Thank you guys again so much for watching this video. I really hope you found it helpful. If you have any questions, feel free to leave them in the comments and I will get back to you. And if you know anyone dealing with pain, please feel free to send them this video so they can take that first step in moving pain-free again. If you liked the video, feel free to give it a thumbs up and subscribe to this channel for more content just like this.